Hi, I'm Dr. Ashish Davalbhakta here at Aesthetics Medispa and Advanced Aesthetics in Pune. In today's topic, we are going to cover microfat grafting. You may have heard about microfat grafting. It's increasingly getting more and more popular, and microfat grafting is for this century what skin grafting was for the last century. It is that revolutionary and it has that many applications. What do we do in microfat grafting? Basically, we take your own fat cells and inject them into areas where we want the application of the additional fat. For instance, it could be deflated areas of your face, it could be scars, and the stem cells that are there with fat. It's also called as adipocyte derived stem cells, and stromal vascular fraction, SVC, if you've come across this term. These components, which are also transferred along with the fat, they have potential to improve the blood flow and to rejuvenate or even restore tissues which are damaged. Hence, fat has enormous applications, not only in plastic surgery, aesthetic plastic surgery, but even reconstructive surgery. We are going to cover only microfat grafting today. So basically what we do is we do a standard liposuction as we do, but either through a syringe-based liposuction device or any technology that you are familiar with. But the fat is collected in a sterile container, and it is sucked out with very little pressure if possible, and then that fat is either sedimented or centrifuged to separate the fat into the components, which are fluid, fat and oil. So we want to discard the fluid component and the oil component, only take the fat component that is left behind. When you do that, you would get either macrofat or you would get microfat in the process. Depends on what size cannula you are using to aspirate. And the fat, if it is taken through 1 millimeter or smaller cannulas, is microfat. If you take it through larger cannulas like 3 millimeter, then you're also getting macrofat globules. So microfat is what we get when it is a millimeter or less in size, and you are then centrifuging it or sedimenting it so that you get compaction of those fat cells, and you then filter out the fibrous tissue or dead fat cells, and once you have filtered it, then what you get is the pure component that you transfer to 1 cc syringes, and then you use even finer cannulas to inject. So anything that is 0.8, 0.7 millimeter cannula, that is microfat basically, and that is injected in the areas that I'm going to be showing you here in this video. So if you see this lady in this picture, you can see that she has deflation in some areas, especially in the under eye or in periorbital area, mid cheek area, and these areas, they deflate as you age. So this is a case where you can see that there is volume loss or fat loss as a result of aging. So those areas you can fill, and they would help in rejuvenating that person to the way the person was before deflation happened. If you look at this slide, the facial fat pockets have been very nicely studied, superficial and deep pockets of the face, and these are distinct fat pockets where you can inject the fat into, and if you put in microfat, that's most suitable for facial revolumization, and you can fill the suborbicularis oculi fat pad, which is underneath, the retroorbicularis oculi fat pad, which is on the upper side of the eye, and the mid cheek and others. These are mentioned here. You can put fat in them and you will get an excellent improvement. So this lady has had a blepharoplasty earlier, but came to me for facial rejuvenation, and has hardly any sagging. and I decided that I would put fat, as I'm showing you here, in that quantity of microfat was injected, and you can see that she is now looking a lot more youthful and at least 5 to 8 years younger than what she is looking, and also fairly balanced. So not only for rejuvenation, but we also use it for recontouring. And there are so many patients who come to me with premature aging, which means that they look a lot older than what their age is. And again, it is because they don't have adequate fat in their face, and that's why they look a little skeletonized, a little gaunt. And this is a subclass of patient who has got angular face, who lacks facial contours, and they have reasonable bony structure, but they have a deficiency of fat. And then you can inject fat into various areas of the face, and you can see that if you fill the normal fat pockets, the microfat can give you a really remarkable change. It softens up the contours, the angularity of the contours changes, and you can get pleasant orgy curve to your cheek and the lower part of your face. This is a technique that is not only helpful in cases of rejuvenation, recontouring, but also in cases of injury. If you've had injury, you've had fat loss, then you can have the fat injected, and you can fill up those deficit areas and get a really nice improvement with almost no scars. It's done mostly through needles, where you inject through cannulas, so there's no cut involved. So this is what microfat grafting is. Of course, you get a lot of swelling after you've had microfat grafting, and the swelling typically takes 6 to 8 weeks to settle. Bruising, if it's there, will take again 3 weeks to go. And of the fat that we inject, usually only 50% survives, and 50% gets absorbed and taken care of by the body. But that 50% that survives is usually adequate. But that gives this procedure a little bit of an unpredictability, and that's why you should be prepared to have sessions or series of injections. In case you feel that it's not adequate enough, you can go ahead and have another session of fat grafting. It just adds on to the fat that you have. An even better outcome, because the scaffolding or the vascular structure has been created by the first fat grafting, and the second fat grafting, the cells go and sit in that nicely vascularized bed, and the uptake on the fat is even better. So this is what microfat grafting is, and if you want to hear more similar videos or learn more about this, subscribe. If you like this video, click the like and share this video. Thank you very much.